All right, now we moved on to atlas dural subluxation. So what we're gonna do is we're just gonna hold and traction slightly at the patient's feet and ask the patient to look left and look right. And you should feel a slight bump is what it's called, just really it's a slight movement in the feet right here. So and then to correct the atlas subluxation, we go through little hairy birds is the acronym, but little stands for long leg side. So on the long leg side, which we established was this leg earlier, what I would do is traction this leg as I ask the patient to hold at the towards the head of the table so they don't come off the table, keeping their head in neutral. I would tension this leg and hold for 10 seconds and then relax, and then I would do that for a set of 3. The next we move on to the short leg side. I'm just kidding. Little hairy bird. Yeah, short heel tension side. So the heel tension short leg side. We move on to that side, and I would traction. And here, as I traction, I would ask the patient to turn their head at a comfortable rate from the left and right continuously for 10 seconds as I hold traction. Then I would tell her to relax, and then we would take a pause and then do another traction set while she turns her head. We would do that for a set of 3. Next is little hairy birds. So little hairy birds, B, last one is bilateral. So we would actually traction and dorsiflex both legs at the same time. And I would ask my patient to look, as she keeps holding onto the table, look towards the side that we had found that there was an atlas subluxation. So say it was the right side, I would ask my patient to look to the right, their right. As I traction down both legs, or traction both legs for 10 seconds, hold for 10 seconds, then we would relax and they would relax their head, and we would do this for a count of about 3 times.